Signs of diabetes in women. According to a study in the Annals of Internal Medicine, between 1971 and 2000, the death rate of people with diabetes mellitus, decreased. This is a major turning point, reflecting many advances in the treatment of diabetes. But the mortality rate among women with diabetes remains alarming. In addition, the difference in mortality between this group and the group without diabetes remained more than double. The difference in symptoms in men and women with diabetes is because women are often treated less aggressively for cardiovascular disease risk factors and diabetes-related disorders. Complications of diabetes in women are more difficult to diagnose. Women are more likely to have different types of heart disease than men. Hormonal changes and inflammation also manifest differently in women. These findings highlight how diabetes affects women and men very differently. If you're a woman and have diabetes, you'll likely experience many of the same symptoms as men. However, there are a few symptoms that are only female-specific. Understanding both of these types of symptoms will help you identify diabetes and initiate treatment early. The only signs of diabetes in women include fungal infections of the mouth and vaginal area, vaginal candidiasis, urinary tract infections, female sexual dysfunction, polycystic ovary syndrome. Symptoms present in both women and men: increased thirst and hunger, unexplained weight loss or gain, fatigue, blurred vision, frequent urination are common signs of diabetes in both women and men. Wounds that take a long time to heal, nausea, skin infections, dark patches of skin in areas of the body with wrinkles, irritability, bad breath, yeast or acetone smell, decreased sensation in hands or feet. Note: many people with type 2 diabetes do not have these obvious symptoms. If you have diabetes and are pregnant or planning to become pregnant, you must be aware of the signs of diabetes in women to ensure the health of you and your baby. You need to monitor your blood sugar and general health before and during pregnancy. When you're pregnant, blood sugar and ketones pass through the placenta to the baby. Children need energy from glucose just like you. However, your baby is at risk for birth defects if your blood sugar is too high. Gestational diabetes accounts for about 1 in 20 pregnancies. The hormones during pregnancy interfere with the action of insulin. This condition stimulates the body to produce more insulin than usual. However, for some women, that is still not enough insulin, and they develop gestational diabetes. For most women, gestational diabetes goes away after giving birth. However, if you already have gestational diabetes, you have a higher risk of developing type 2 diabetes. According to the Women's Health, U.S. Department of Health and Human Services, you're at risk of experiencing signs of type 2 diabetes in women if over 45 years old, being overweight or obese, having a family history of diabetes, childborn weighing more than 4 kilograms, ever had gestational diabetes, having high blood pressure, having high cholesterol, exercising less than 3 times a week, have other health conditions associated with problems using insulin, such as polycystic ovary syndrome, PCOS, a history of heart disease or stroke. Women of all ages have difficulty controlling blood sugar. This is due to hormonal changes related to the menstrual cycle, pregnancy or menopause, or the use of birth control pills. Fortunately, if you apply some of the following measures, you can prevent and delay the development of the disease. Lose weight and exercise. Research from the Diabetes Prevention Program shows that you can prevent complications from type 2 diabetes by losing 5 to 7% of your body weight. To do this, eat healthy foods and exercise 30 minutes a day, 5 days a week. Don't smoke. It increases your risk of diabetic kidney disease or nerve damage in your feet. Diabetes treatment. Follow your doctor's instructions in maintaining blood sugar, blood pressure and blood fats. Learn the signs of complications, including heart attack, stroke, diabetic ketoacidosis. Although diabetes-related mortality has not decreased as much in women as in men, understanding and managing symptoms and complications can help you lead a healthy life.